I think before we get into how Africa is faring in terms of vaccine numbers, let's quickly speak about how we are seeing a lower infection, or we're seeing a high infection rate, but we are seeing lower deaths and hospitalization numbers. Is this a sign that we are winning the fight against the pandemic?
For having me, and good afternoon. So the outbreak has really evolved on the continent. We have seen, this is the 10th week, we have seen continuous decline in number of cases in the region, but it doesn't mean that, it's good news, but it doesn't mean that the war is already won. We have to continue to make sure that we are implementing all the measures that has brought us to this level so far, and continue to enhance our capacities, because the risk of another wave is still there. So it's not time to celebrate yet. Yes, cases have declined, but we need to make sure that we are still vigilant.
The hogging of vaccines is still a problem, especially for the African continent. We do know that previously there was an outcry as to how more developed countries that had almost fully vaccinated their population were even considering a booster jab, yet the majority of Africa had not been vaccinated. Is hogging of vaccines still a problem?
Yes, so let me quickly take you through the current status of where we are on the continent. So far we have received about 200 million doses from the different vaccine supply chain, COVAX, AVAD, bilateral donations, and we have administered 143 million doses. We have about 60.9 million people fully vaccinated on the continent. So yes, the vaccine inequity still remains. Africa is still lagging behind with regards to the vaccination. If you look at what is happening in Africa compared to what you see around the world. So we have only about 4.4% of our population vaccinated, and other countries are having more than 50, 60%. Some even have 70% vaccinated. So you can see the stark difference. So yes, vaccine hoarding is still happening. COVAX is not able to get some of those doses because they are already pre-booked by some of those high-income countries. So that is why we continue to advocate that they give up their space on the queue so that COVAX can have more doses, and continue with the dose sharing as well, and bilateral agreements with countries.
Just speak to us about whether or not there are any, which I'm sure there are, but specific countries that are of concern in terms of their vaccination numbers.
Okay, so majority of the countries, if you look at the statistics we have 15 countries that met the 10% target for September 2021, but majority of our countries actually lie between around 2% of their population covered. So really, apart from those 15 countries, most of these countries are of concern, and we think that more doses need to be given to these countries, because if you look at the 15 countries that received, that were able to meet the targets, actually had more vaccine doses than the other countries on the continent. So they had more supplies, 2 bilateral donations plus their COVAX and AVAD supplies. So that's what we want to see for the remaining countries again. So it means that we have the remaining almost over 30 countries still lagging behind. I cannot call a particular country at the moment because we have over 30 countries in that picture.
Sure. And then just speak to us, Dr. Mary, with regards to certain countries remaining on red lists. For example, South Africa remains on the UK red list, and it seems as though because of the concern of the beta variant, yet it's the Delta variant that's dominated our high infection rates. Is this a concern for the World Health Organization that certain countries are almost treated unfairly because of certain variants?
So with regards to travel in general, in the context of COVID-19, this has been one area of challenge that we have seen. We haven't seen travel affected like this before by any type of outbreak apart from this COVID. And travel restriction has been one of the major challenge. So what we have recommended to countries is to apply what we call risk-based approach to international travel. But of course, countries have their own national regulations that they use to apply. But what we call upon is for really for fairness in terms of access to travel across the world, not just putting restrictions on countries around Africa. We know our vaccination is very low. The issue of the variant is not limited to Africa, but of course, we need to make sure that countries are implementing the risk-based approach in a very fair way to allow for people around the world to travel. So quite a number of countries do require additional measures, like they ask you to test before you come, and some are asking for quarantine when you arrive. So this is, we had it a lot, especially around the European countries with regards to travel. But we continue to advocate that there should be fairness in terms of the way we travel around the world.